So I'm Dr. Paul, Secrets of Chiropractic Success. I've opened 77 offices in 20 states. So we help doctors start a practice, grow a practice, from starting a practice, becoming highly profitable, to hiring, knowing how to hire, train, and manage associate doctors, to creating wealth. That's what we do. So one of the big topic I wanted to go in today is there's a huge problem that I see, and this is routine, is doctors are buying an expensive piece of equipment because they think that's what's going to get them business. And there's nothing further from the truth. I could not tell you anything what the dentist has or the optometrist has. I couldn't tell you anything about their equipment. I go for the benefit of going to the dentist, not the feature. Features are the therapies. So I'm not going to go to the dentist because he's got, the J7000. I'm going to the dentist because my tooth hurts and he can help relieve my tooth pain. That's why I'm going to the dentist. So no different than chiropractic, but this is a huge mistake and a huge misconception that doctors are making, and they're buying these very expensive machines with monthly payments, and they're only buying one, which is a nightmare, because that alone will cap the growth of your practice. As soon as you have two people coming in at the same time for that therapy, you now have patients waiting, and waiting is a practice killer. It's the number one chief complaint of going to a doctor: waiting. It's a practice killer. Some things are real big practice killers. This is a major practice killer. In other words, I go to a dentist, and every time I go, I've always got to wait. I don't want to keep going to that dentist that I don't want to tell my friends and family members. So remember, your whole office should be set up to where as soon as they sign in, they can immediately go back. That's 80% of the business. So 80% of your business should just be after they sign in, they can just go right back, go to the adjustment care therapy, and leave. That's how easy the flow should be. So you want to stay away from these big, expensive machines for many reasons. Number one, they're expensive. The number reason is, remember, when we look at machines, we're always going to consider these factors when we look at them. We go, well, how much space does it take? That's one. How much labor does it take? That's two. All these are costs. Space will decrease your profitability. The more space it takes, the less equipment, the less therapy stations you'll be able to have. Labor, how labor intense is it? Some of these therapies are unbelievably labor intense. I'll give you an example, like the old hot packs. Those are labor intense nightmares. So it's not only space, labor, it's the cost of the equipment. And it's not just the initial cost, it's the repeat cost of the equipment. And then it's the reimbursement. How much are you getting reimbursed for it? I mean, you'll still have chiropractors doing hot packs, which you don't even get paid for pretty much in today's day and time with major medical insurance. And it takes a lot of labor. It's labor intense, and it takes a lot of space, because you not only have the hydroculator, you got to have this big stand to put those pads on and help dry them out. It's a complete nightmare. Or labor is like an attended therapy, like ultrasound. That's a passive therapy. It's not an active therapy. So that means you don't get paid very, very much at all. A lot of major medicals don't even pay for it at all. Hell, when I stopped practicing, the payments were down to like $7. So you go space. So it typically doesn't take a lot of space depending on how you set it up, labor. And then also you got to have multiple units. You can't have one unit because you can't have people wait. You need a minimum of 3 units to see at least like 80 to 120 visits a week. And you never want to buy a piece of equipment for 20% of the business. So that's why I would never buy a piece of equipment for plantar fasciitis or all these one-offs that you may see once a month or once every 3 months. You never want to do that. You always buy equipment for the 80% of the people, not the 20% of the people. And too many times I go in a doctor's office, I'll see one piece of equipment. sitting there with dust on it. Usually it's not just one, they'll have two or three pieces of equipment that's only good. That's they're not for the same thing. So this unit's for one thing, this unit's for one thing, and the doctor thinks he's trying to help anybody, and he's not, he's running his ass around. They don't come in for that. And I'll give you another example here in just a second. So this is what we're paying attention to. We're going space. How much space does it take? Labor. How labor intense is it? Time, that becomes, is it passive or is it active? Because that's going to determine on the reimbursement. And then, not only now we practice the sides of the three phases healing. So we want to make sure we have therapies for all three phases. And then not only the cost of the equipment, we don't want expensive equipment. And then we don't want to get stuck on a lease for a $20,000, $50,000 piece of equipment. And then you definitely don't buy a piece of equipment that's not going to be used by 80% of your patients. I've gone in the offices before and they've been sold on this decompression. So it's a huge machine, takes up a lot of space, which means you can't have more units in there. You can't see more people. Usually it's cost prohibitive. It'll cost $30,000, $40,000, $50,000. Doctor's not going to pay $100,000, $200,000 for 3 or 4 decompression tables. And then there's the ongoing lease payment. And then you go, okay, what kind of reimbursement? Well, there's doctors that are not what we would say using the decompression patient education properly, and they're billing it as a traction device. So they're paying $20,000, $30,000, and it's being billed for $30 traction. That's not how it's designed. It's designed, and the patient education is designed to be a high dollar per visit. But a lot of times the doctors don't do it because they never learn it, or it's too confrontation. So now you got this 30,000, 50,000, 20,000 piece of machine. You're not even using 80% of the time. It's sitting there half the time. That's like the example I was just given. I go in, doctor has one decompression machine. So it's too much space. It's labor intensive. It takes a lot of labor to strap them up, put it all on, take them all off. What's the highest overhead in an office? Labor. So you got a space problem, you got a labor problem, you got a cost problem, because even if you're going to spend a lot of money on one, chances are you're not going to spend a lot of money more than two. And you have to have a minimum of 3. When people come in, they can't be waiting, because waiting is a practice killer. So if you have one unit and 2 people come at the same time, now you have people waiting. Say you can't do that. You have to have usually a minimum of 3 to see between 80 and 120. 3 units will typically get you up to about 120 to 130 visits a week, depending on how labor intense it is and whether it's a passive or active therapy. See, these are all major considerations. So how many units can you do? The cost, the repetitive cost, space, labor. And then you never want to buy something for 20% of your practice or less. 80% of your practice, your patients should be using your therapy, or you should sell it, get rid of it, because you can't chase every condition. And every time you add a new machine, you're increasing your overhead, you're increasing your labor costs, you're increasing the complexity of your training, who does what and how do they do it. There's a reason McDonald's went from a barbecue place selling 43 items and not doing very well to the McDonald brothers looking at their profit sheet and saying, wait a minute, we're making 80% of our money from these 9 items. And it happened to be shakes and colas and burgers and cheeseburgers and fries. And so they totally scratched the 43 different services that the vast majority of people aren't buying regularly. They ditched it, simplified, saved a lot on space, labor, and equipment, and they sold what the majority of people bought. See, that's how you run a business. And so if you got a machine that's not being used 80% of the time, I suggest you get rid of it. And so anyway, we go in and there's this machine. I go, when's the last time you used it? I asked the doctor, I said, when's the last time you put a patient on that? He goes, I think it was about 2 weeks ago. I said, get rid of it. Get rid of it. And what we did is we put another therapy unit there. And so instead of him having 2 units or 3 units, now he had 4 units so he could see more people. In other words, now he was utilizing the space. But I can't tell you how many offices I've walked into, and there's an expensive piece of equipment sitting there collecting dust. Sometimes even the doctor has his jacket on it or something like that. I mean, that's how ridiculous this is. So you don't want to get into that. Buy a piece of equipment for a hangnail, buy a piece of equipment for plantar fasciitis, buy a piece of equipment for carpal tunnel. They're all unique pieces of equipment instead of a piece of equipment you can use for 80% of your patients. See, you'll go broke. That's a never-ending story. There's too many conditions out there and too many different units for different conditions. You'll just go broke. You'll just keep adding more overhead, more cost, complicating the what I call the Ford assembly line. You've only got 4 hours a day to see patients. You don't have 8. They come in during industrial hours, 4 to 6 in the morning and early after. That's it. They're not going to schedule 3 times a week during work. They're not going to take off a half hour early to come in your office 3 times a week, or take off a half a day 3 times a week, twice a week to come into your office. It doesn't happen that way. So, and that's what I told him. So we not only got rid of it, I said, you're using it for 1 or 2 or 3 patients a month. I said, get rid of those patients and fill them with patients that use 80% of your equipment. It's kind of a hard concept. Doctors have a hard time letting go of stuff. They like collecting stuff, but they have a real hard time. If they're going to use it once in a month, they just like to hang on to it. Oh, I better not, I'll lose that patient. No, you should lose that patient. I'm telling you, you should lose that patient and replace them with 2 or 3 patients that are going to use 80% of your equipment all the time. Don't get bogged down and tied up with this concept. But it seems like it's very difficult for doctors to let go of equipment. Very difficult. I found it. They just get emotionally attached to it, even though they're only using it 3% of the time forward. So that's one of the things I'll do. I'll look at the office. I'll go, okay, how much are you using this equipment? What percent of the time are you using this, and this? And then how many units do you have? Because I already know you can only see so many patients with these different units before you start causing people to wait. And that's one of the practice killers. All this matters. And then you got it spread out. You got space, you got labor, you got equipment. And then even the marketing message is a nightmare. And just another example, I was dealing with a client. I was looking at the video. We were looking at his layout, and I saw in his room he had this therapy unit. I go, what's that? He goes, oh, that's for knee decompression. I'm like, well, guess how many people know about a chiropractor and pick up the phone and call a chiropractor to get their knee treated? Well, 7%, remember, there's only 8% of the population looking for chiropractors. Only 7% get treated for extremities. And we're not talking 7% for the knee. So we're probably talking, let's say 25% of the 7% might be for the knee. Let's say it's even 50%. So you're only talking about 50% of 70% of 8%. You're talking about a real small number. In other words, it's not affordable. You're not going to get patients coming in for that. So what are you always going to have to do? You're going to have to spend money. You're going to have to spend money advertising to try to pull people in, because they don't call the chiropractor for a knee problem. So you got to look at the statistics also. And chiropractors don't do that. They're buying this equipment for people that don't even call chiropractor for. So what does that mean? You got to spend money for it now. And then you need more than one. So this gets just to be a nightmare when you start violating this. It just gets to be a running nightmare. I don't know of anybody that has one office or one therapy with expensive equipment or multiple therapies that are only one that max out, that see more patients than they physically can see. I don't know of one in 30 years, not one. I know a lot of offices that see back pain and neck pain, what people come to chiropractors for, and they need one associate, two associate, three associate doctors. I know a lot of offices like that, mine also, mine including. So what happened with this doctor? It's sitting there empty. I go, well, how's that going? He goes, well, sometimes advertising works, sometimes it doesn't. So it's really a break even. We're not making any money. And then I explained to him why? Because you're not going to a chiropractor for knee pain. There's an unbelievably small number of people that are going to do that. So he spent $20,000 for this machine that's sitting there empty. He's not even using it more than 20%. Remember, if you're not using a therapy 80% of the time, you should be getting rid of it or get more of them and then spend the time and money marketing it. But the bad news about the advertising, when you buy these pieces of equipment for problems that are outside the gateways of chiropractic, gateways are the reason people come to chiropractors. And you just look at the numbers. And once you get outside of back pain, neck pain, and headaches, they drop fast, 7% into extremities. Start dividing those numbers up. Those are some real small numbers. As soon as that happens, you got to spend your way to new patients. And you're not guaranteed, and there's only one guarantee with advertising, you're guaranteed eventually it's not going to work. And that's exactly what happened with him. He advertised it, got some patients. Most of the time he didn't. He broke even, was losing money. So he spent $20,000 on one piece of equipment and he even stopped advertising now because he wasn't even making money on it. So it's sitting there empty. It's taking up space. It's empty. He paid $20,000 for it. He's got a monthly payment. I can't tell you how many times I've seen this kind of thing happen. So that's a huge mistake. It's a huge mistake to buy one therapy. Takes a lot of space, takes a lot of labor. It's a lot of cost. There's a repeat payment. And then sometimes you don't even get reimbursed. You don't even get reimbursed. Like that machine, he doesn't even get reimbursed for it. The patient had to pay cash, which again, you got to be that much better if insurance isn't going to pay for it. So, I mean, what do you think the patient's going to do if their insurance pays for them to go to an orthopedist for their knee therapy or to come to the chiropractor and they got to pay for it out of pocket? What do you think is going to happen? Well, that's what does happen. So these are all the reasons why, there's so many chiropractors that aren't doing well. There's a lot of reasons, and most of it's knowledge and skill. They just don't know, and they're making a lot of bad decisions. And then one bad decision is on another. Next thing you know, there's so much crap going on. It's like you gotta unroll layers just to get the practice up and going and seeing patients, because there's so much layers of crap going on with flow, marketing flow, gateways, just everything. So I can't tell you how many times I've walked in from one doctor who had a cervical machine, didn't use it. Again, it was a $30,000 machine. I had one machine. Another doctor with a decompression machine. This doctor with the knee machine. And I asked them all. I said, if you had more patients, back and neck pain patients, for what you're good at, what's easy, what you already have systems for, what you can buy more equipment that you don't have to wait and it's not expensive, would you have bought those pieces of equipment? And every one of them said no. Well, why are they buying it? Because they don't know how to fill up their office with the number 1 and 2 reason and 3 reason people come to a chiropractor and have very inexpensive therapies with high reimbursement. They don't know how to do that. That's called marketing. They don't know how to do that. So what do? They chase. They're the big one on the market now is the Shockwave. And the insurance companies go through cycle. When things come out initially, they'll cover it. Chiropractors seem to run to it. And if it's outside of why people come to you, guess what? You're going to have to spend money. There goes your overhead. There goes your profit. And the likelihood of you making more money back on it is slim to none. Or you could just every chiropractor could just spend money and advertise their way to success. If that was possible, there wouldn't be any problems. Just spend the money on advertising. You'll easily make 3-to-1 or greater return on your investment, and just keep spending the money and keep building your practice. But that's not reality. Advertising doesn't work like that. Oftentimes it doesn't work, doesn't give you the return on investment, et cetera, et cetera. So anyway, that's exactly what I'm seeing going on. And Shockwave's the latest one. It's like a $20,000 machine. Now the reimbursement's high. Now they're starting to limit it to once a week or twice a week. And then next thing you know, they'll start decreasing the amount of reimbursement. They'll decrease the frequency. And then the doctor's stuck paying for a 20,000 machine. And then you only have one. And it's attended. I can't believe it when I see people doing that Shockwave. I mean, they literally got to sit there and do it, or they have to have labor doing it. Labor, the most expensive for your overhead. They take the most expensive thing in overhead and they increase it. They actually have to be doing it. I'm like, oh my God, what a nightmare. And I'm not even talking about from a positive feedback loop. That's one of the reasons I hated doing ultrasound. It didn't give much of a positive feedback at all. That's why I didn't particularly care for physical therapy. The feedback's so slow. Chiropractic, boom, patients start to feel better quickly. The feedback, what you get as the doctor. So there's a lot of different reasons. But anyway, that's what I'm seeing now. It's like every 10 years, there's another gadget on the market that costs $30,000, $50,000 from the subluxation station. Where's the subluxation station? I've gone into doctors' offices and they're in the closet. From the decompression units that aren't even being used, that are taking up space and labor. And the doctor doesn't know any better that they should get rid of it and then replace it with a therapy. There you have more than one therapy and you can actually see more business, and then learn marketing. Actually learn how to fill your business up without spending all this money on advertising. So that's what's going on. So highly don't recommend that at all. Don't follow. And I didn't follow that trend, especially if you want to replicate offices. You want to open a second office, third office, you better not be buying expensive equipment, because the doctor in this office with that expensive, he thinks he needs that equipment to succeed over there. And if and when he doesn't, he blames it on not having the same equipment. That's another reason why I never went for this expensive equipment. I never would have been able to open 77 offices. Never. And we did about $80 to $90 million a year, treating back pain and neck pain, not plantar fasciitis, not osteoarthritis of the knee, with $20,000 equipment. It was $600 for 3 units for our therapy, but we grew it up to 6. We always maxed it out so the doctor could see as many patients as he physically and emotionally could. And then we taught him marketing. And it was like a Henry Ford factory. People moving in, and everybody knew what to do. It was smooth. McDonald's didn't go from 9 products to 43 to increase their revenue. And by the way, that's called violation of line extension. Overhead skyrockets, labor skyrockets, complication and systems and training skyrockets, profit margins decrease. All of that becomes not. People make a lot of money by replicating, not by diversifying. You make a lot more money seeing more back pain patients, not trying to see plantar fasciitis, back pain, carpal tunnel. That's not that's not how people make money. That's how you limit your exchange of time for money. When you're good at very few things and you do it at high volume, high efficiency, low overhead, low labor, low space, that's where people make a lot of money and help a lot of people, by the way. I helped a lot more people seeing 300, 400 visits a week than the doctor down the street criticizing me because I only had 5 therapies and I didn't treat anything else but back or neck pain. And he's seeing his 60 visits a week. There you go. All right. Again, I'm Dr. Paul, Chiropractic Secrets, Secrets of Chiropractic Success. Again, we help chiropractors start practices, grow practices, hire trained associate doctors, and create wealth. Check us out, Secrets of Chiropractic Success.